Assalamualaikum. Welcome to Mind Healthcare. Today we talk very interesting topic about health behavior. What is health behavior? So, introduction to health behavior promotion and overview, changing health habits, cognitive behavioral approaches to health behavior change. An introduction to health behavior. Health behavior are the choice and action individual make this influence their well-being. Understanding and promoting these behavior is essential for improving overall health and preventing disease. Role of behavior factor in disease and disorder contribute factors. Behavioral factors play a significant role in the development and management overseas diseases and disorder. Unhealthy habits such as smoking, poor diet, and lack of physical activity are linked to an increased risk of chronic disease like heart disease, stroke, cancer, and diabetes. Disease prevention, conversely, adopting healthy behavior can have profound impact on preventing or managing these conditions. Lifestyle modification like quitting smoking, maintain a balanced diet, and engage in a regular exercise can significantly improve health outcome. Health promotion and overviews goals. Health promotion aim to empower individuals to make informated decisions that lead to healthier lifestyle. It encompasses a range of strategies and interaction designing to influence individual and community health behavior. Strategies. Health promotion often involve creating supportive environment, provide education and resource and advocating for policies the promote healthy choice. It is multi-factors approach that address social environment and behavior determinants of health behavior and health habits. Nutrition consuming a balanced diet rich fruit, vegetables, whole grain and lean proteins in circle for maintaining overall health and well-being. Physical activities, regular exercise has neurons numerous benefits including reducing the risk of chronic disease, improving cardiovascular health and boosting mental well-being. Adequate sleep is essential for optimal cognitive function, mood regulation, and overall health. Getting enough quality sleep supports physical and mental well-being. Stress management. Chronic stress can have negative impact on health. Effective stress management techniques such as mindfulness and relaxation practice are important for maintain well-being. Practicing and changing health behavior. Self awareness become aware of your current health behavior and their impact on your well-being is the first step toward making positive change. Setting realistic and achievable goals can provide direction and motivation for behavioral change. Break down larger goals into smaller, manageable steps. Action plan. Develop a plan that outlines specific actions you will take to achieve your goals. Consider strategies of overcoming potential barriers. Support network. Seeking support from families, friends, healthcare professional, or sport group can increase your change of success in behavior change. Maintenance. Once you achieve your goals, it's important to maintain the new healthy behavior as part of your ongoing lifestyle. So, next is the stages of behavior change. Pre-contemplation. Individuals in this stage are not considered changing their behavior. Contemplation. People in this stage are aware of the need for change and are the thinking about making it. Preparation. Individuals in this stage are making plan and preparing to change their behavior action. People in this stage are actively taking steps to change their behavior. Maintenance individuals in this stage have sustained their behavior change for significant period. So next is effective strategies for promoting health behavior. First is education. Education in which providing accurate and engaging information about health behavior can increase awareness and knowledge. Skills training, teaching individual how to make healthy choice and develop skills for maintaining those choice is essential. Environment sports, creating environment that make healthy choice easy and accessible can promote behavior change. Social sport encourage social connection and sports network can provide motivation and accountability for healthy behavior. Policy change avoidant for policy that promote healthy choice can create systematic change that support individual behavior change. So next is counseling, empowering individual for health. Promoting healthy behavior is a circle aspect of improving overall health and well-being by understanding the factors that influence these behavior, implementing effective strategies and supporting individuals in their journey toward healthier lifestyle. We can empower individuals to make positive choices that lead to healthy future. The health belief model, a cognitive behavior approach to health behavior change. This topic delves into the health belief models, is also called HBMS, stand for Health Belief Model. Its application in cognitive behavior therapy, CBT. CBT stand for Cognitive Behavior Therapy to promote health behavior change. It explores the key construct of the HBM, Health Belief Model. Its role in motivating individuals to adopt healthier habits and effective of CBT in achieving sustainable behavior change. This will also touch on replace preventing strategies and the evidence support CBT is effectiveness. Define the health belief model. Foundation. The health belief model is a psychologically framework that helps explain and predict health behavior. Developed in the 1950s, it postulates the individual decision about health behavior are based on their perception of application. The HBM is widely used to health education and promotion program. Its application extend to versus health behavior, individual smoking, suggesting weight management, adherence to medicine, and prevention secreting. So next is key construct of health belief model. First is perceived susceptibility. An individual belief about their likelihood of experience a health risk it about how personally virtually they feel perceived severity. The individual belief about this seriousness of the health risk both in terms of its potential consequence and impact on their life. Perceived benefit, the individual belief about the positive outcome engage in the recommended health behaviors such as reduce risk, improve health behaviors such health or increase longevity. Perceived barriers, the individual belief about the challenges cost of negative aspect associated with engaging in the recommended health behavior. Case to action. Case to action are external events that promote our desire to make a healthy change. They can anything from a blood pressure when being present at a healthy fair to seeing a condom poster on a train are having relative die of cancer. AQ action is a something that help move someone from wanting to make a healthy change to actually making a change. Self effectivity was not added to the model until 1988. Self-efficacy look at a person's belief in their ability to make a healthy related change. It may seem trivial, but fifth in your ability to do something has encompassed impact on your actual ability to do it. Finding ways to improve individual efficiency can have a positive impact on health behavior related behavior. Next is implying the HBM to health behavior change, understanding perception to effective apply the HBM its circle to access and understand individual perception about the health risk, the potential benefit of engaging in the desired behavior and the perceived barrier. Tolerate intervention based on the HBMS should be tolerated to address specific perception and tailor message to reason with individual belief and concern. Enhance motivation by focusing on the HBMS constructure intervention can effective motivation individual to engage in health behavior change. Cognitive behavior therapy is also called CBT, stand for cognitive behavior therapy for health behavior change founding. First is foundation. CBT is structure, goals, orientation approach that focus on identification and changing unhealthy thought, feelings, and behavior. Collaborative process. CBT is collaborative process between the therapist and the patient. The therapist help the patient identify and challenges unhealthy thought pattern and develop coping mechanism. Behavioral change by changing negative thought and behavior. CBT aim to help individual make lasting positive changing in their lives. So CBT technique cognitive restriction, goal setting and self motivation. Cognitive restriction, this individual identification and challenges negative or unhelpful thought and replacing them within the realistic positive ones. Goal setting specific, measurable, achieve, relatable, and about pounds goals can provide direction, motivation, and can be progress. Monitoring, tracking through thought, feelings, and behavior can provide insight into pattern, trigger, and progress, facilitating self awareness and accountability. Replace preventing strategies, identify triggers, understand the situation, emotion, or thought that can lead to replace is essential for developing strategies to preventing them. Develop coping mechanism, having a plan to manage craving or other triggers such as a relaxation technique, exercise, or social sport in a circle for preventing replace relapse. Plan for step recognition that step back are the part of the change process and having a plan to get back on track essential for maintaining motivation and progress. Evaluating the effective of CBT for health behavior change. First is evidence based. Numerous studies have demonstrated the effectiveness of CBT for a wide range for health behaviors. Sustained change CBT has been shown to lead to long-term sustainable behavior change compared to other approach. Cost-effective CBT is cost-effective intervention, particularly when considering its long-term impact on the health and well-being. Characteristic of health compromising behavior. In this chapter, we address health compromising behavior, practiced by people that undermitigate or harm their current or further or future health. Understanding the characteristics of health compromising behavior in circle for promoting well-being. By adopting healthy lifestyle choice, we can reduce the risk of obesity and its associated consists the topics where as a strategies point for making information decision and embarrassing a healthier lifestyle. So next video on it, what is obesity.